Hi, everyone. Good evening, and thank you so much for joining us. My name is Megan, and I'm the Marketing and Communications Director with Concierge Pediatrics. And on behalf of Concierge Pediatrics, welcome to tonight's webinar. With the recent childhood vaccine schedule recommendation changes from the CDC, now differing from recommendations coming from the American Academy of Pediatrics and other medical groups, we recognize that parents have been left with a lot of questions. So we're here tonight to present those changes, help parents understand what it means for you, and describe how our practice takes the approach for childhood vaccinations. We will be led in tonight's presentation by Dr. Jonathan Jassey, a board-certified pediatrician for nearly 20 years who serves as the founding pediatrician and chief medical officer for Concierge Pediatrics. Dr. Jassey practices out of our offices on Long Island in Roslyn and Woodbury, and we'll be making some guest appearances at our Belmore office when it opens later on this year. If you're looking for a new pediatrician, all of our offices, including Short Hills, New Jersey, are accepting a limited number of new patients. Tonight, Dr. Jassey will share some of his expert insights and we'll go through some Q&A at the end. We received several questions in advance of the webinar, but if you look at the bottom toolbar on your screen, you'll see a Q&A button where you can ask some questions throughout the evening, and we'll do our best to answer them during that Q&A session. As you exit the webinar this evening, please take a minute to take the survey that'll pop up on your screen. We'd really love to hear your feedback. We want to continue offering these types of events and make them useful and meaningful to you, and your commentary is so important to allow us to do that. And with that, I'll hand it off to Dr. Jassey.
Thank you. Thank you, Megan. Thank you, everybody, for attending this webinar tonight, talking about a very important topic with vaccines. And we're going to discuss what parents need to know and how we partner with you. So we'll take it away. And if you have questions along the way, feel free to put it in the Q&A button. The goal tonight is not to win any sort of argument. It's to lower the fear, raise the clarity, make sure you leave knowing what we know with high confidence, what's generally uncertain and how we handle that uncertainty, and how we can work together even if you're not ready to say yes to every vaccine today. Our practice strongly supports routine childhood vaccination because we see the benefits: fewer hospitalizations, fewer tragedies, fewer missed school days. At the same time, many parents are scared, and there's a lot of conflicting information online and sometimes even across institutions. We're not here to shame anybody. This webinar is for educational purposes and not individual medical advice. Always seek the advice of from your personal physician. We will explore the current medical landscape and acknowledge differences and recommendations from healthcare institutes without any political commentary. The presenter has no disclosures to report. Tonight's agenda: we're going to review changes to the CDC, for Disease Control, compare with the American Academy of Pediatrics. We're going to discuss about history of vaccine hesitancy and concerns from parents. We'll discuss vaccine schedule, how it's changed over time, and what we do in our practice, as well as some state regulations from New York and New Jersey, and then a Q&A. So first off, what does a vaccine do? A vaccine is a way of training the immune system using a preview of that germ or part of it so that when the real infection shows up, the body can respond faster and more effectively. What a vaccine doesn't do, it doesn't use up the immune system. Kids encounter thousands of immune challenges through normal life, between food proteins, dust, viruses, bacteria, fungal infections. The immune system is built for learning. What a vaccine does, it reduces risk. They're not magic force fields, but they dramatically reduce the chances of severe disease, hospitalization, and long-term complications. What's normal for a side effect? Well, most vaccine side effects are expected immune responses. What are some commonly seen side effects? You could have a low-grade fever. Most of the time, it doesn't go above 102. You could have soreness, redness, and swelling to the injection site. That's not an allergic reaction. That's an adverse reaction, similar to if somebody had prunes and they had diarrhea, kind of similar to that aspect. And some kids can even be a little bit fatigued for the first day or two. Serious adverse events can occur, but they're rare, whether it's anaphylaxis, seizures, Guillain-Barré syndrome, blood clotting. These things are very rare, especially in the pediatric space. I could thankfully say in almost 20 years of doing this, I don't think I've ever seen any of these instances happen. But always speak with your physician about concerns and consider risk versus benefit. So let's go over some new CDC childhood vaccination recommendation changes. Well, first off, The American Academy of Pediatrics and New York and New Jersey State and other states, especially in the Northeast region, they're adhering to American Academy of Pediatric guidelines. So we must proceed with that guidance for public school attendance. The CDC is the national leading institute in the US under the Department of Health and Human Services. The CDC typically supports local health policies, but they have no governance over any medical decision making over physicians. They're bound to their state medical board and their licensing boards. The American Medical Association, the American Academy of Family Physicians, and the American Pediatrics have announced their disagreement with the CDC changes, leaving us at an unprecedented divide and lead issues. The CDC, again, does not control state laws, so their recommendation changes may not affect the policies in your state, such as public school vaccination requirements. So the recommendations for all children through the CDC is to be getting their DTaP, which is diphtheria, tetanus, acellular pertussis, which is whooping cough, their Tdap, which is basically a booster as you get older, the Haemophilus influenza type B, which is not the flu. It's a different type. It's actually a bacterial infection, unlike the flu, which is a viral infection. And that can be a serious infection, which can lead to ear infections, pneumonia, meningitis. Pneumococcal vaccines, similar to the Hib vaccine, also protects against ear infections, pneumonia, and meningitis. Polio, MMR, chickenpox, and HPV. There's some recommendations for high-risk groups, whether RSV, which is a newer vaccine, which we'll get into in a little bit, hepatitis B, meningitis A and B, and hepatitis A as well, especially if you're traveling to an area that has a high hepatitis A and endemic over there. And there's, according to the CDC, the recommendation when there are changes is some shared clinical decision making between the rotavirus vaccine, COVID, which is highly a hot topic on that front, flu, hepatitis A and B, and meningitis as well, to be discussed with your physician. The American Academy of Pediatrics has no changes to the previous recommendations for 2026. Still the same recommended schedule. They usually get 3 hepatitis Bs in the first year of life. They usually get 3 rotavirus vaccines in the first 6 to 8 months of life. They get 3 DTaPs in the first year, plus a fourth one at a year and a half, and then a fifth one to get into kindergarten. Hibin and pneumococcal, you get 3 in the first year, you get your fourth between 12 and 15 months. Polio, it's 2, and then you in the first year, and the third one can be given under a year or over a year. You get your fourth one to get into kindergarten. Flu and COVID are more optional on that front, but if you're going to do it, you get 2 doses in the first year of getting it, and then it goes to once a year. RSV, it's given in the first 8 months of life. MMR and chickenpox, you get your first dose at the 12 to 15 month mark, and then your second dose to get into kindergarten. And your hepatitis A can be given as young as 12 months, and usually that's a 2 dose series. Meningitis, HPV, both meningitis A and B, you get later on. You need a tetanus booster to get into sixth grade in New York. You need a meningitis vaccine to get into seventh grade. And then even for colleges, you need to get your second boosters of your meningitis. So let's talk about a couple of the different illnesses. First, rotavirus. What is rotavirus? It's a highly contagious virus, which is really a bad stomach virus. It could lead to extreme vomiting and watery diarrhea, which could lead to dehydration, hospitalization from severity. It's spread fecal oral through hands, surfaces, diapers. It's very common in daycare settings. It can be especially dangerous for infants due to dehydration. And it's a 3 dose series from the vaccine. It was licensed. People think it's a newer vaccine. It's not. It's been out for my whole career. It's been out for 20 years now. And it can prevent severe disease and hospitalization. It's a 3 dose series. The third one has to be given before 8 months or it's not allowed to be given again. Now with rotavirus myself, just personally, when I did my residency locally on Long Island over at Winthrop Hospital, we had, I would say in the spring and summer months, this is before the vaccine was even there, probably a quarter to a third of the kids that were hospitalized were due to rotavirus, and they were severely dehydrated on IV fluids for sometimes 3 to 5 days. And it was a pretty hairy situation, and that was for inpatient. So that's when you're really sick enough to go there. The amount of outpatient cases we would see would be through the roof. And since the vaccine has been out, I could say that I maybe have seen in my almost 20-year career, like a handful of true rotavirus cases. So really, it shows that the incidence of these illnesses can go down from vaccinations. Uh, Even another story, one of my former colleagues in my former practice, they actually did not give the rotavirus to their child, and they actually ended up, unfortunately, getting rotavirus and was also hospitalized for a couple of days. So not fun to deal with that. Flu, influenza, aka the flu. I think we all know about that. We're all living and breathing it right now, and this winter's been pretty bad with it. Thankfully, it's on the trend down at this moment, but there's always a second wave. There's a winter wave, and then there's a spring wave. So we haven't even begun our second wave yet. But it's a respiratory viral illness that can cause high fever, body aches, and coughing. But it can lead to some severe complications. Pneumonia, bronchitis, ear infections are common. In extreme situations, respiratory failure. This has spread respiratory droplets, aerosols, and contaminated hands and surfaces. So pretty contagious. Young children, elderly, and those that are pregnant or especially immunocompromised are at further risk. Vaccine's been out for a long time, since
Dr. Jassey,
1945.
I'm so sorry to interrupt, but I've lost your audio. Can you move a little bit closer to your microphone? I'm not sure if our audience has potentially also lost your audio.
Can you hear me now?
Yes.
Thank you. It's not a new vaccine. It's been around for a while, since 1945. It's usually updated annually by scientists to try to match the circulating strain of what's in Australia and that hemisphere. Um, they're not always right every year on that front, but it can prevent severe disease and hospitalization. So the flu vaccine, out of all the vaccines, really doesn't, I feel like, you can still get the flu with it. That's not going to necessarily stop you from catching it, but it's to help mitigate some severe complications that can happen. And again, these things do happen, and it can happen in a healthy individual too. Last year, this year, there have been definitely quite a few. There's been a handful of pediatric deaths, unfortunately, even in the New York State and in the tri-state area when it comes down to flu. And in the vast majority of those cases, those people were not vaccinated. So that's where vaccinations can be very helpful on that regard. COVID, hotly topic on that front. I think we all know about COVID, respiratory viral illness, known from the pandemic from 2020, 2023. There are some secondary complications from pneumonia, inflammatory syndromes, and hospitalizations from severity. It spread airborne aerosol droplets, contact, stay indoors, and infants, or especially those that are immunocompromised or have underlying heart and lung issues, are definitely at further risk. And we know that there's several versions of the vaccines, which again is not going to stop you from catching it, but it's going to reduce severity of the illness. Again, more hotly topic thing there. I think between physicians and from patients alike. Some want to get it on board to have protection, especially when they're young or if they have underlying issues, and some, if they're healthy, they want to leave it alone. And I think at this point in time, it's become a more milder illness because we have been exposed to it numerous times from either vaccinations or just being exposed. Hepatitis A. Um, this is another important vaccine, uh, not necessarily mandated by the schools, recommended from American Academy of Pediatrics and all various places. This is a highly contagious illness too, which can lead to actually liver infections, which can lead to jaundice, fatigue, joint pain, and stomach upset, but in rare situations can lead to liver failure and death. Um, it's spread via fecal oral transmission or contaminated food and water. This is kind of gross, but when we go out to eat, if the chef doesn't wash their hands appropriately, there is a risk as far as hepatitis A, and can't say it's 100% rare on that front. It could also be found in oceans, in seafood, and various things there. But uh, for those that are on this presentation from Long Island, uh, probably about 10 years ago, there was an outbreak at the shish kebab restaurant from a hepatitis from a chef that didn't wash their hands. Um, in my old practice, there was a local 7-Eleven that had a hepatitis outbreak. So it can happen at really any restaurant or anybody that's touching your own food, and you just run the risk on that front. Out of all the vaccines, it's probably the mildest for all kids to get. Really, I've never seen any side effects with it. It does not cause fever. I don't even think I've ever seen redness from it as well. Um, but it's been out since the mid 90s on that front. Hepatitis B, another one. Uh, That also can lead to liver infection, which can lead to jaundice, fatigue, joint pain, and stomach upset. But the more imperative reason why people get hepatitis B, because a lot of people say, well, it's usually spread through blood, body fluid, sexual contact, IV drug use. Uh, but it definitely can be transmitted during birth if the mother is infected. So chronic hepatitis B can lead to liver cancer, and that could lead to major issues from that regard. But newborns are especially at highest risk. On that front, the vaccine has been out since the 1980s, with the CDC recommendation in 1991 for all infants to receive the vaccine. Why is that? Well, not saying this is happening in our neck of the woods, but across the entire country, there are a lot of parents that are not getting, or a lot of mothers that are not getting prenatal care. And if they weren't getting prenatal care, if the mother had hepatitis B, the baby was going to have it, again, potentially leading to lifelong issues. And they just made it more universal for everybody on that front to really be protecting babies. And I don't think, knock on wood, I've ever even seen a hepatitis B case because of from the vaccination aspect. But regardless of that, um, very safe vaccine. Again, never seen any side effect with it, no redness, swelling, anything like that. You got to keep in mind, and we'll get into this in a little bit, if a baby has a fever, especially in the first 8 weeks of life, we buy ourselves a ticket back to the hospital where we have to do a whole big battery of tests, including spinal tap, because they are immunocompromised and they're at risk of further serious infections. Which is why some people will hold out on having the baby be seen in public until they start getting their actual first round of then vaccines. But uh, if there was a chance that hepatitis B can cause a fever, no pediatrician would ever do that because then there would be a greater risk of that child potentially getting a fever and then going to the hospital. So again, really safe vaccine that's been around for a long time. RSV. Right now, it's the number one viral illness that is going around in the Northeast region. It overtook flu, which was number one for the past 8 weeks. Now it's RSV. So RSV is a common respiratory virus that can affect anybody, not just infants, but it can affect anybody with fever, coughing, sometimes difficulty breathing, especially for infants or the elderly or asthmatics. It could lead to bronchiolitis, pneumonia, and ear infections. This is a very contagious illness too that spread via respiratory secretions, droplets from an infected person's coughing or sneezing. Babies, especially those under 6 months, are at risk. But this vaccine or immunoglobulin, this is kind of different type of vaccine, is it was approved in the US in 2023-24. And as pediatricians, we've been waiting for years for something like this to be approved, and you have to be under 8 months to get it, or a pregnant mother can get it at 32 to 36 weeks gestation, which then the baby does not need to get vaccinated. It's a one-time dose and you're done. You can get it during RSV season, which is typically from September to April. It's a one-time dose and that's it. And even though there are some cases that are mild, RSV is the leading cause of hospitalizations in babies in the first year of life. And the data has been really good so far on the RSV vaccine. Last year, it was actually came out that there was a 90% reduction in hospitalizations as far as babies. So pretty amazing. And I think parents have been pretty adamant as far as getting it, which I highly agree. HPV, another controversial vaccine. And I'm not sure why. It's been out for a long time, since 2006. People seem to think it's a newer vaccine. It's not. It's been around for a very long time. And pre-COVID days, vaccines used to have to go through like 7 years of clinical trials before being shown safety to be able to be given to then a patient. So really, if you really count the trials, it's really been out for almost 30 years at this point in time. And it's a sexually transmitted viral infection with over 100 strains. Um, it's not used to treat existing HPV. It's to prevent against 9 common strains of HPV. But some complications from HPV, warts, risk of cervical cancer is big. So this is a kind of the first vaccine of its kind that could indirectly prevent against a form of cancer. Oropharyngeal cancer, which this vaccine used to be meant for females initially at first, from the ages of 9 through 26. Now it's extended out. I believe it's extended out to 45 now. But then it actually now is recommended for men also over this past 5 or 10 years. And actually, oropharyngeal cancer in men, the number one cause is from HPV. So it again, another vaccine that can indirectly prevent against a form of cancer. Uh, there are complications, whether anything from anal cancer, vaginal cancer, vulvar, or penile cancers. So again, can be a good thing. And it's spread from sexual activity. And I think maybe that's part of the controversy that a lot of us parents don't want to th think about our kids as they get older, doing any of those things. So, but with that said, there's always a risk for unprotected sex. So even though it's recommended from 9, again, now to 45, this is an interesting vaccine that the studies have shown that it takes better to the body when you give it at a younger age. So when you do it before the age of 15, it's actually a two-dose series. And if you start it after 15, it's a three-dose series. The whole point is you want to kind of catch them before anything is even being thought upon from sexual contact. For my patients, I usually do the tetanus booster at 10, the meningitis vaccine at 11. I usually do HPV if a parent wants to do it at 12 and 13. So we're done from that. And there's actually newer studies that are coming out that one dose may even be enough to fully protect somebody, but that's not fully recommended just yet. But that might be on the horizon. Meningitis, another serious vaccine, another serious illness as well. Out of all the vaccines, arguably the most important one for kids to get because it's rare, but it's a life-threatening infection of the brain and the actual bloodstream. And it can happen instantaneously. There's different forms of meningitis, bacterial, viral, there's other forms as well, but viral is the one you would want if you ever had it. Bacterial is what this is protecting you against, which could be deadly in a matter of hours. And if you're lucky enough to even survive, there could be issues, hearing loss, limb loss, uh, neurological injuries. And this is not necessarily from like a huge um, spread. It could just happen instantaneously. You have no underlying pre-warning that anything was even happening. It can be spread either some respiratory secretions you already have that all of a sudden can just turn into like meningitis, or if there was a close contact, there's always a risk. But the young, the immunocompromised, college students are at great risk. When you're living in close quarters with people, sleepaway camps are at great risk too, just for the fact that, again, you're living in close quarters. So there's further risk of transmission of germs. It's been out for a while. There's meningitis A, there's meningitis B, which again you need for college, but it was licensed since 2005 there. Personal story for me, during my training, again, pretty local, we always had to rotate through different various components of the hospital. And I had a rotation in the pediatric ER, and it was like 6 o'clock in the morning, and a mother who was a nurse brought her 16-year-old daughter in, who was deathly ill looking. She ended up with meningitis. She was lucky enough to survive. She was hospitalized for like 3 months, but what happened with meningitis, it can lead to gangrene. And she actually lost part of her foot, a couple of fingers and toes. She had devastating consequences on what actually happened to her. I don't recall if she was vaccinated or not. I don't know if she had her booster. But again, very, very scary stuff. MMR, I think we all know about measles, mumps, and rubella. Another hot topic. These are three highly contagious diseases which can cause fevers, rashes, coughing. It all goes with measles. You can have swollen salivary glands with mumps, and a mild fever and a rash with serious pregnancy risk with rubella. Secondary complications can lead to pneumonia, inflammation, deafness. Encephalitis is rare but can happen. It can be serious. Birth defects, and this is a very highly contagious illness, especially measles, with contact, respiratory droplets on surfaces for a long time. Infants and children are at risk. Immunocompromised people, unvaccinated people are at risk. Uh, and keep in mind that high vaccination rates have significantly reduced these diseases in the US, but outbreaks can occur in these unvaccinated communities, as we're seeing, as this last year was one of the highest levels of measles that we've seen in years. The MMR is a single combination vaccine which protects us against all three diseases. Years ago, when I first started in my practice, they had it available as splitting it up. They stopped making it that way. Um, and they don't even have the option anymore. They may be in Europe, I think maybe in England, but it's not in the US. So your only option is from the combination. It's typically given in two doses at 12, 15 months, and again, 4 to 6 years for lifelong protection. Let's talk a little bit about a brief history of vaccine hesitancy. What happened? There was this paper, this Lancet paper in 1998 by this Andrew Wakefield that clicked the link between MMR and autism based on a review of 12 total children. It was flawed with cherry-picked cases, and there was no control group, and it was later fully retracted. But the damage has been done, and Dr. Wakefield was had to retract all of his statements, and he was in for patented medicine again. But this no fraudulent narrative can outlast retractions and cause measurable drops in vaccination coverage. Question itself raised doubts and fears among us. There's been ongoing research for years, large studies, huge meta-analysis of all various studies, combining them all together, has been conducted to address these claims. In a recent analysis, the World Health Organization, citing results of 31 primary studies, 2000 to 2025, reaffirmed there's no link between vaccines and autism. Um, so yeah, there's been nothing published. Everything that's been published has shown that there is no evidence that supports any vaccine adverse events and causality of MMR or of causality of then autism. Some ingredient concerns. So looking at some things with the ingredients. So first, with formaldehyde. That is used to inactivate viruses like polio or detoxify toxins like diphtheria during production to make the vaccine safe. Tiny amounts of residual formaldehyde can be found in vaccines, less than what's in your produce. And I don't know if we all know, but your body actually also produces and makes a small amounts of formaldehyde as part of their metabolic process. Aluminum is used in vaccines as an adjuvant. You got to keep in mind, vaccines, there's your antigen, which is the illness that you're protecting against, and then there's your adjuvant to add to it, which can boost your body's immune response to the vaccine and means you need smaller quantities of the vaccine and fewer doses. Adjuvants are tested extensively before approval and licensing in vaccines. It's been out for a long time. And aluminum also can be found in breast milk, antacids, and natural freshwater body sources. Thimerosal mercury, that's always been a concern from people, and as that's naturally found occurring element in the earth, it's used usually more in multi-dose vaccine vials to prevent growth of bacteria and fungi to make it safe. Um, but most vaccines that we have and that's out there are all individualized doses nowadays, so it's not a big to do. The parental concerns between thimerosal and autism or any neurological disease through research hasn't found any link. And it's been out of the rotation in any vaccine since 2001 as precautionary measure, and there's still much higher risk of autism than ever before. And I don't know, did you know, but the MMR vaccine never contained thimerosal. Other public concerns today, vaccines and autism, that remains a common concern due to this study that we said before by Dr. Wakefield. Signs of autism tend to appear during toddlerhood, and there can be a regression in that first to second year of life, and that's when a lot of these childhood vaccines take place. In almost 20 years, I personally, and in my old office, I had close to 20,000 patients, I've never seen a kid becoming autistic ever after getting any specific vaccine. I've seen kids as well that their sibling had autism and they were adamant that the second kid was not going to get any vaccine, and they still came down with it because it's been found to be more of a genetic link. The million-dollar question is why? That there's still no full answers on. There's a lot of hypothesis out there, whether environmental, advanced paternal age, there's a lot of different things there, but um, again, haven't seen that, specifically from the vaccines. And it's not just from anecdotal stuff. There's evidence-based medicine that relies on clinical decision making based on the totality of high quality evidence rather than a personal story of somebody's friend or anything like that. Studies continue to find no causal link between vaccines and autism. There was a recent Danish study that analyzed over 1 million Danish children over 21 years, and it found no link between the aluminum in vaccines and autisms. And a recent analysis, as I said before, from the WHO that cited results of 31 primary studies that reaffirmed there was no causal link between vaccines and autism. Natural immunity, some people may say, well, isn't it better just to get it and get the illness and have natural immunity? Yes, it could create strong immunity, but it comes at the cost of the disease itself, which is exactly what we're trying to avoid. Any secondary issues with pneumonia, encephalitis, deafness, infertility, hospitalization. So I know that there's been a lot of chickenpox parties, which is very hard to find nowadays. Um, but there's also risk involved from that regard. Vaccines are a way to get much of the immune benefit while dramatically reducing the chance of severe illness, hospitalizations, and death. In infants, especially under 8 weeks, or especially, keep in mind, babies are living off of their mother's antibodies for the first 6 months of life. So infants, especially when they're young, they're very at risk for, and they're very susceptible to diseases and infections. So early vaccines help their immune systems fight better as they grow. An honorable mention, we'll talk a little bit briefly about vitamin K at birth, which is not on the CDC's list, but this has become a newly hotly topic. And this is not a vaccine, it's a nutrient injection. And they're provided at birth for years for the infants due to an inefficiency that some babies may have at birth. And vitamin K shots prevent dangerous internal bleeding, especially male babies who, if they have a circumcision, they're at really risk for bleeding and bleeding out at that point. And vitamin K deficient bleeding, they can occur in other areas of the body too, male or female, besides the skin, umbilical cord, in the nose and mouth, but most importantly in the GI tract and in the brain, which if there's bleeding in the brain or in the GI tract, it could be a life-threatening issue at that point. And bleeding may go undetected. Signs can include paleness, easily bruising, blood in the stool, but overall increase in vaccine hesitancy has reduced the acceptance of some of these vitamin K shots. So I would highly, strongly encourage getting the vitamin K. Why are there so many increases in vaccines over the years? It's a common question I've gotten from parents during my career. Well, from when I was growing up, we only got X amount of vaccines. How come there are so much more now? What changed? Well, in the 90s, when a lot of us was growing up, there was fewer vaccines because fewer were available. There was less protection against these serious childhood illnesses, against Hib and meningitis and pneumococcal, and those are serious illnesses from that regard. Older vaccines had more antigens, and there were fewer long-term safety systems. Today, there are more vaccines because there are more diseases that can be prevented. And, speaking to some of those families, again, I've seen some horror stories during my training. That's why I feel like 99.9999% of pediatricians always believe in vaccines. We've seen the horror stories during our training that parents never saw. I've had kids with whooping cough at 2 months on a ventilator. I've had kids during my training at 6 months that passed away, unfortunately, from pneumococcal meningitis that could have been prevented from the vaccine. So these are more serious diseases are preventable now. And today you get a stronger protection early in life, and there's more targeted vaccines with fewer total antigens, and there's ongoing safety monitoring. Now, there are some guidelines from New York and New Jersey. New York State has not changed, neither has Jersey, and they currently align with AAP guidelines, not the CDC guidelines. In New York, and if anybody has any, questions, there's a QR code that will actually link you to your state's website as far as all information if you want about guidelines. But in New York, within 14 days of the first day of school or daycare, parents must show proof of the child's up-to-date vaccinations or provide a valid medical exemption from vaccination. In New Jersey, immunization records must be presented on the first day of school. You need your meningitis and Tdap vaccines are required for all entering sixth graders who are 11 and up. Updates to immunization records must be provided to the school as the child receives any further vaccinations. Now, showing some safety and effectiveness of vaccines. Before vaccines get approved, vaccines go through a step-by-step development and testing process, which usually takes years. They are studied in clinical trials with thousands of participants to check safety, dosing, and effectiveness. Results are reviewed by the FDA through a formal biologic licensing process before approval. After approval, and this is key, vaccine safety continues to be monitored as millions of people receive vaccines. There are multiple US systems that track and review side effects to catch rare issues early. Doctors and public health experts regularly review this data and update guidance when needed. And an overview of the safety system is published by the CDC in their Pink Book. And this is a good slide if you want to take a picture of it and look at it at your leisure. This is through the CDC's website about the vaccine life cycle and showing the safety at every phase between initial research to eventually being given and then post-approval monitoring and research. So if you want to take a picture, you could look at that. Um, oop, sorry. And just with reactions too. Like serious allergic reactions to vaccines is very rare, is about 1 in 1 million doses. So very rare to have like a serious reaction in that front. Now, what do we do at Concierge Pediatrics? We listen and educate. We can use a personalized vaccine plan that will work with our patients on that front. We do not provide any medical exemptions. Unless if somebody is immunocompromised on immunosuppressants and there is a legit medical reason for that. Otherwise, there is no medical exemptions that they will get. You really have one of three choices on what to do when it comes down to vaccinations. Either comply and follow the state recommendations and do it, and we could go at a slower pace. Secondly, is moving out of state because there are some states that might not make it mandated. Or thirdly, is homeschooling at that point. So those are really what your options are from that regard. But with us, we provide a personalized plan. And an example, we prioritize vaccines that protect against the most serious early childhood illnesses. So when we're ready, we can start. And if we want to go slow, we can go slow. Um, we have the option. We either will do the singular vaccines or the combo vaccines, which is usually meant to reduce the number of shots. And when you look at pros and cons that people can have their own arguments, some people want to do separate vaccines. So if there is any reaction, they could pinpoint where is it due from. And I get that aspect, but there's going to be more injections that we are going to need at that point. And for those people that just don't love any additives in any vaccines or anything like that, you're doing that more often then. Or the combinations, which is multiple of the antigens or the illnesses that are combined in one, then you're getting, first off, you need less shots. Second off, for those people that are concerned more about any of the additives in the vaccines, you're getting less of the amount in the vaccine, and then all the vaccines by doing the actual combos. So you have that aspect. You can catch up a little bit quicker from that regard. And a lot of the vaccines, even if you could have a side effect of a fever and irritability, you're not going through it as frequently as you would if you are doing it separate. So those are some of your pros and cons. But we usually will have follow-ups, whether it's every 2 weeks or 4 weeks, to catch up and continue the sequence that we're laying out for you. And we can individualize the plan based on age, the school exposure, some medical history issues, travel issues, or prior reactions. Um, one thing that's important, we will not refuse care for your child if you're choosing not to vaccinate. We do believe embedding the relationship isn't good for children. We will keep talking, keep educating, and when needed, we'll consider a modified, personalized schedule aimed at getting your child protected as safely and quickly as possible. There's no fear, there's no guilt, just thoughtful, evidence-based care. Could always ask questions. We're here for you. Bring what you've read. We're here to work through it together. Your happy and healthy child is our priority. We want to work collectively together to ensure that that child's going to grow up to be nice and healthy. All right, so we're gonna go through some questions.
I'm back. Thanks for breaking that down, Dr. Jassey. I know there was a lot to unpack here, and parents will have a recording of this webinar available on our website in the next couple of days if you want to look back on anything that we discussed here. We did get quite a few questions from parents in advance of the webinar that I'd like to go through with you and get your thoughts if you have time. Does that work for you, Dr. Jassey?
Sure, let's do it.
Fantastic. Actually, let's start with one that came through the chat during this webinar regarding the HPV vaccine. Can HPV resolve on its own?
Um, there's always a chance it can, but you're running the risk again of it turning into not just from a wart perspective, but it could turn into a cancerous lesion at that point in time too. So, um, again, why play with fire at that stage of the game? So from that regard, it's always more recommended to be vaccinated than not. But Megan, I don't hear you.
You hear me now?
Now I do. You were
Sorry
you
about
were
that.
muted. It's okay.
Never been quiet in my life, but apparently today was the day.
Mhm.
I know we went through this a lot. Someone's asking the new schedule for vaccines, and they wrote what's not mandated anymore. Now, of course, I think we have to specify mandated as far as that's state guide, but I think the question is probably what the CDC is not recommending for everybody anymore. Can you just read through that list one more time?
Yeah, that was some of the stuff that was recommended or talking through with your doctor, whether it's the RSV vaccine, the flu, the COVID, the hepatitis A and B, the meningitis, rotavirus, or what was being discussed.
Okay.
But again,
At
that's CDC, that's not AAP or the New York or New
Right.
Jersey.
Yes. And we have to also pay attention to the New York State guidelines and New Jersey State or whichever state you're attending from here tonight. At Concierge Pediatrics, is vaccination documentation given on the same day as the vaccine administered?
If requested, yes, there is. We have a pretty strict process too that any vaccine that gets taken out through our system, we actually scan it with this phone that we have for it, and you have to put an order in for that specific vaccine before you could scan out a vaccine. Then we scan it to ensure safety that no incorrect vaccines are being given. Uh, and then it will populate that into our electronic medical record at that point with all the lot numbers and everything like that. There are plenty of people that need their school physical and they get a vaccine and they need forms like ASAP or even right then and there, which we'll give to them on the spot and we'll print out an updated vaccine form for them to give to their school nurse. So yes, that could be done.
Okay. Just looking through the list of pre-submitted questions. Okay, also just a reiteration, in working with parents for a customized vaccine schedule, do you allow delayed vaccinations?
Yeah, it's never our way or the actual highway. We do again like to work with parents to collectively make sure that the ultimate goal is that child growing up to be nice and healthy. Um, I mean, my personal view doesn't mean it's right or wrong. It's just my view. I always tell this to parents all the time, is that even if there wasn't a 1 in a million chance of a vaccine causing autism or anything on that nature, there are always risk in everything in life. There's risk taking Tylenol or anything like that. But when it comes down to it, is even if there wasn't a 1 in a million chance of that, at least I have my child here that I could still take care of. Versus on the contrary, if there is a 1 in a million chance of coming down with one of these horrible, not common colds, life-threatening infections, and if they, God forbid, we're not here anymore again, you got to take pros and cons to everything in life. So, regardless of that, we have, again, we can do delayed vaccination schedules. That's fine. I have plenty of people that will do that. I will create a plan for them and when to come back between this visit and the actual next checkup. So again, whether they're coming in, we actually, by the way, we never do more than 2 injections at once. So keep that in mind. And then we'll see you, whether it's once a month, whether it's once every 2 weeks, whatever that it may be that we collectively work together to create that plan. So yes.
Next question. I have an immunocompromised family member. What is the safest route?
Um, Well, there's a couple of things here. First, not only protecting that child, but also could be indirectly protecting that immunocompromised family member. They're at greater risk of serious infections, and kids are the biggest vectors of transmission of germs, so you run the risk of spreading to others. So even more important to get that child vaccinated. But caveat here, some live vaccines that really should be discussed with that immunocompromised person's hematologist or oncologist or rheumatologist on if they can be surrounded by somebody with that, because sometimes they cannot, and then that child cannot get a live vaccine until that situation is different.
Okay. Next question. I think you touched upon this, but also good to just reiterate. Why are we giving vaccines to babies, and shouldn't we wait until their immune system is stronger?
That's a good question, but the schedule is really more designed because the risk of these severe outcomes is often highest in infancy for certain diseases. So if we're going to wait, that could really increase the risk when the kids are most vulnerable. So as we said before, if you're going to especially if you have a fever in the first 8 weeks of life, we're going back to the hospital, and they're not getting their vaccines yet, but in the first year of life, they still are, their immune systems are not up to par. So that's where you just run the risk if we're not protected that it could lead to severe outcomes.
Rounding out, just a couple of questions left that were submitted. I don't see it. And oh, well, we might have a new one in the chat. Let me take a look. Oh, here's a good one. Which of these viruses and bacterial infections have no treatment or cure?
Uh, that's a good question on that front.
A lot to think about, right?
Yeah, I mean, there's a lot of illnesses on that front. I think it depends on what happens from complications. So, like chickenpox, and people ask that all the time, like, why do we need a chickenpox vaccine? We all had it growing up. I mean, I know that I personally had it,
I got it.
but some reasons for that is this, in modern day times too, we see a lot more skin infections, impetigo, all various things, and I could only imagine. I work at my kids' sleepaway camp at times during the summer for part of it, and we see so much skin infections. If somebody had chickenpox, we all have bacteria all over your entire body. You could be introducing infections even further that way. I could see that these skin infections would explode further. And then the cost savings from parents that don't have to miss a week of work from that stuff. And I'll never forget my first pediatric experience. I was a medical school student at North Shore Hospital in Manhasset, and there was a healthy 7-year-old that was actually on a ventilator from chickenpox pneumonia that she had. And she was pretty ill at that point. So, you always run those risks of high things. So it depends on how severe and then
Not sure if
illness
anyone else
gets.
is having this issue. I lost your audio again. Can you just repeat that last sentence, Dr. Jassey?
Um, yeah, I'm not sure what the last thing that you heard. If it was about my experience with seeing a child with chickenpox pneumonia that was on a ventilator, that was on my first pediatric rotation ever as a medical school student at North Shore Hospital. So that was eye-opening on that front. So to answer the question, though, as far as is there treatment for these illnesses? Some of them can be, but it could be too late in the process, like meningitis. You get put on antibiotics for it, but if it's not caught early enough, and even if it is caught or early enough, like I mentioned before about that 16-year-old patient that when I did my own training and she lost some limbs and fingers and toes, she got started on antibiotics right away. But the disease process in itself was so severe and serious that it still wasn't enough it was enough to save her life, but she still had dire consequences on what happened. So with some of these illnesses, there are some treatment, but sometimes it's if the consequences and the severe complications that can happen have arisen, it might not even work at that point.
Okay, understood. Two questions left. Uh, Next one is, if these diseases are rare, why are we bothering with vaccinating for them?
Well, rare largely because of vaccinations at that point. It really has, I mean, the amount of true chickenpox cases that I've seen during my career has been on one handful also. So that rotavirus it really has shown that vaccines work and they really reduce them. But when vaccination rates drop, outbreaks do return. Measles is a perfect classic example of that. I mean, measles was eradicated in this country. Um, I think by like 2000, and it hadn't been seen for years. But now, because vaccine rates have dropped, you need to have that herd immunity effect and have X amount of percentage of the population to be vaccinated to prevent spread to others. And you're not just helping yourself, you're helping the community at large as well. And now that rates have dropped, outbreaks have returned, unfortunately.
Seeing that a lot in the news these days. And looks like our final question, oh wait, maybe one more. Nope, that was a comment. I'm sorry. Great. My favorite question that was submitted is, Dr. Jassy, are you accepting new patients?
Yes, we are accepting new patients at all of our locations, Roslyn, Woodbury, Short Hills, to be Belmore. But yeah, if there is anybody on this webinar that is not a patient and was just curious to learn information, I hope that you gain something out of this. And if it's something that whether you're pregnant or you have children or you wanted to have a practice that's willing to work alongside you, we're definitely here for you and would be, lucky enough to meet everybody and developing a plan on how we can work together.
Question made me smile. All right. Well, Dr. Jassy, you've covered a lot of ground this evening on an important but not always so simple topic. So thank you very much for all of your insights on this. Thank you
You're
to all
welcome.
of our guests who've taken the time out of your schedules to join us tonight. We really hope this was helpful to you. And please take that survey at the end so we can understand your thoughts and your feedback about how this went tonight. If you want to stay connected to Dr. Jassy and Concierge Pediatrics, please give us a follow on Instagram and Facebook at My Concierge Pediatrics. Or, of course, you can visit our website to learn more about us us at conciergepediatrics.com. And I think it's time to close out the session. Dr. Jassey, any final thoughts?
No, thank you everybody for again showing tonight. Appreciate you taking the time on a busy evening and stay healthy and warm, especially these days, and safe, and hopefully be speaking to you soon.
All right. Thank you, everybody. Have a good night.